Beer is not just alcohol. It contains a specific compound from hops that is one of the most potent phytoestrogens identified in any food source. Combined with alcohol's direct hormonal effects, beer creates a triple estrogenic insult that directly drives prostate growth. Today I am explaining the complete mechanism. I am Dr. James Whitaker, board-certified urologist, and today I am naming something specific that I tell men in my clinic to eliminate when they have prostate problems, and that thing is beer. Not alcohol in general, though alcohol has its own significant negative effects on the prostate and testosterone that I covered in detail in a separate video. Beer specifically, because beer contains a compound in addition to alcohol that makes it uniquely harmful to male hormonal and prostate health. Today I am explaining the complete mechanism, and I think most men watching this will be surprised by what they learn. Let me begin with what we know about the relationship between regular alcohol consumption and prostate health in general, before I address why beer is a special case. Alcohol at any dose above minimal consumption has documented negative effects on the prostate and male hormonal health through several mechanisms. Alcohol elevates aromatase enzyme activity. Aromatase is the enzyme that converts testosterone and other androgens into estrogens, primarily estradiol. In men, estradiol at physiologically normal levels is important for bone health, cardiovascular health, and libido. But when estradiol is chronically elevated above its normal range, as it tends to be in men who drink regularly, it provides a direct estrogenic stimulus to prostate cells that promotes prostatic stromal growth through estrogen receptor beta activation. Regular alcohol consumption also impairs hepatic estrogen clearance, the liver's ability to metabolize and excrete estrogens, compounding the elevation of biologically available estradiol. These alcohol-related hormonal effects are present to some degree with all types of alcoholic beverages. But beer adds an additional estrogenic insult that is specific to its ingredients and that makes it particularly problematic for prostate and hormonal health in men. Beer is brewed using hops, the dried female flower cones of the Humulus lupulus plant, as a primary bittering and flavoring agent. Hops contain phytoestrogens, plant-derived compounds that structurally resemble estrogens and bind to estrogen receptors in human tissues. The specific phytoestrogen in hops that has received the most attention in pharmacological research is 8-prenylnaringenin, abbreviated 8-PN, which is classified in peer-reviewed literature as one of the most potent phytoestrogens identified in any dietary source. Its estrogenic potency is estimated to be substantially higher than the soy-derived isoflavones that are most commonly discussed in the context of dietary phytoestrogens. What this means in practice: when a man drinks beer, he is simultaneously receiving the aromatase-promoting and estrogen clearance-impairing effects of alcohol that all alcoholic beverages share, plus a direct phytoestrogen dose from the hops that activates estrogen receptors independently. This combination produces what researchers describe as a triple estrogenic insult, more testosterone being converted to estrogen through alcohol-mediated aromatase upregulation, less estrogen being cleared through alcohol-mediated hepatic impairment, and direct phytoestrogen-mediated estrogen receptor activation from the hops themselves. Each of these three mechanisms works in the same direction, increasing net estrogenic activity in the body, including in the prostate. Let me explain why elevated estrogenic activity specifically worsens prostate disease. The prostate contains both androgen receptors, which respond to testosterone and dihydrotestosterone, and estrogen receptors, specifically estrogen receptor beta. In the aging male, the balance between androgens and estrogens shifts progressively. Testosterone declines by 1 to 2% annually from the mid-30s onward, while estradiol declines much less and in some men actually increases as central body fat, which contains high concentrations of aromatase, accumulates with age. The net effect is a relative increase in the estrogen to androgen ratio over time. Estrogen receptor beta activation in the prostate promotes proliferation of the stromal cells, the supporting connective tissue cells that make up a significant proportion of prostate volume. Regular beer consumption, by chronically elevating the estrogenic environment through all three of the mechanisms I described, directly accelerates the hormonal shift that drives BPH progression. Please subscribe to this channel right now. I am Dr. James Whitaker, board-certified urologist, and this is the kind of specific, mechanistically honest information that I post every single week. Hit subscribe, Hit like and drop a comment below right now. How much beer do you currently drink per week? Your honest answer tells you something important about how much this is affecting your prostate. I read every comment. Beyond BPH, the estrogenic effects of beer consumption have implications for the broader hormonal health of men over 50. Testosterone is progressively suppressed by the mechanisms I described, both through the conversion of testosterone to estradiol via upregulated aromatase and through the central suppression of the hypothalamic pituitary-testicular axis that alcohol produces. The net result in men who drink beer regularly over years is a progressive testosterone to estradiol ratio shift that manifests as reduced libido, reduced muscle mass maintenance, increased central body fat accumulation, which itself contains more aromatase, creating a self-reinforcing cycle, reduced energy and motivation. Some craft beers use very small amounts of hops or are brewed with alternative bittering agents. The phytoestrogen content of beer varies with the variety and amount of hops used, with beers that use large quantities of aromatic hops, including many popular craft IPAs containing the highest concentrations. The alcohol-mediated hormonal effects apply to all beers regardless of hop content, so even very low hop beers are not prostate neutral. What about non-alcoholic beer? Non-alcoholic beers that are brewed with hops still contain the hop-derived phytoestrogens. The phytoestrogenic compounds are not alcohol-soluble and are not removed by the de-alcoholization process. Non-alcoholic beer eliminates the alcohol-mediated hormonal effects but retains the phytoestrogen exposure from hops. Whether this residual phytoestrogen exposure at the concentrations present in non-alcoholic beer is clinically meaningful depends on consumption volume and individual sensitivity. My clinical recommendation to men over 50 with BPH, lower urinary tract symptoms, or any evidence of declining testosterone is to eliminate beer from their diet. If they wish to consume alcohol occasionally, red wine at modest amounts has a different and somewhat more complex hormonal profile. Resveratrol and other polyphenols in red wine have some aromatase-inhibiting properties, though even red wine is not prostate neutral in large amounts. The most favorable option from a prostate and hormonal health standpoint is complete alcohol elimination, with the most dramatic improvements typically seen within 4 to 8 weeks of stopping. The practical experience of my patients who eliminate beer is instructive. Men who stop beer consumption and simultaneously address the other dietary factors, refined sugar, processed high-sodium foods, spicy evening meals, consistently report reduced urinary frequency and urgency within 2 to 4 weeks, improvement in stream quality within 4 to 6 weeks, reduced nocturia within the first week through the reduced diuretic load, and improved sleep quality, as testosterone levels partially recover from the alcohol-mediated suppression. I am Dr. James Whitaker. Beer is your prostate's worst enemy. That is not a metaphor. It is a biochemical reality. Subscribe for weekly evidence-based medical content. I will see you in the next video.